As an assistant professor of the Zucker School of Medicine at Hofstra University and Northwell Health, Dr. Gary Weiss shares his knowledge of urology with students and treats patients on a regular basis. Although he has become an accomplished doctor, medicine was not always Dr. Weiss's passion. As a young boy, he decided that he would become a scientist, more specifically an engineer. As time went by, he became more interested in the things that scientists actually did, such as developing knowledge, conducting research, and exploring. By the time he was ready to enter college, he had decided on either physics or chemistry, but by his sophomore year, he considered medicine as a possibility, as he would be able to continue his interest in research. With a new goal in mind, Dr. Weiss went to the pre-med advisor's office, and she asked why he had not come to her sooner, as his grades were excellent and he had taken the prerequisite courses already. With that encouragement under his belt, he applied to various MD and PhD programs and was accepted at Albert Einstein College of Medicine at Yeshiva University. He earned a PhD in molecular pharmacology, which required extensive work in development cell biology. At this stage of his career, he did not anticipate becoming a surgeon full-time, but he believed that this would be a good way to start out, since it was the area of medicine that appealed least to him. Much to his surprise, however, Dr. Weiss found that he loved it, and he subsequently decided that he would pursue a surgical field. Following his graduation from Yeshiva, Dr. Weiss was accepted to a general surgery residency at Vanderbilt University. There, he discovered his talent and passion for urology, so he applied for the urology program at the completion of his residency. On a personal level, Dr. Weiss found it was more pleasant to work in urology than other departments, as he felt that the doctors and staff tended to enjoy their jobs more. He also noticed that patients understood the hard work that the staff was putting in on their behalf, and they were very pleased when their doctors were able to help them. Dr. Weiss completed his urology training at the University of Rochester, but he felt that he still had more to learn before going into practice or academic practice. He had long been interested in cancer from a biological and scientific viewpoint. He likens cancers to complex problems that must be solved by surgeons and researchers who he views as heroes. Dr. Weiss was very pleased with his oncology work because it combined surgical techniques as well as research. When the time came to begin his career proper, Dr. Weiss found a job as an attending in the urology department at Long Island Jewish Medical Center. He also ran a laboratory that put out some research papers during his first few years. At that time, getting funding for research was difficult, and there was pressure to produce. In the end, as much as he enjoyed scientific research, he loved taking care of patients more. He brought his research to a close and started a clinical practice 30 years ago, where he has served ever since. He is still full-time and is now at the point where he no longer performs surgery, limiting himself to office practice, which he enjoys. In his advice to future generations, Dr. Weiss suggests that they do what they love. While there are certainly doctors that are in it for the money, the truly great doctors are those that love their work and are passionate about helping people. Similarly, when it comes to choosing a specialty, medical professionals should follow their passion, not chase a paycheck. He advises that they try to learn from as many people as possible, whether they are mentors, colleagues, patients, or other staff members. In the end, the best part of the job is having real human contact with patients and knowing that your work is helping people. In terms of his personal life, Dr. Weiss considers his greatest achievements to be his wife Patricia and his two daughters, Sarah Kay and Juliet.